Ladies and gentlemen, thank you for standing by. Welcome to the NCD Alliance webinar. During the presentation, all participants will be in a listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Thursday, April 30th, 2015. I would now like to turn today's conference over to Dain, Executive Director for the NCD Alliance. Please go ahead, ma'am.
Thank you very much. Good morning, good afternoon, or good evening, everybody, and welcome to this NCD Alliance webinar. It's been a while since we had our last webinar, which was in the beginning of March, I believe. So a great deal has happened over those last 6 weeks. And today, presentations are going to be made by Alena Matzke from the NCD Alliance based in Geneva and Priya Kanayson from the NCD Alliance based in New York. The main focus of today's webinar is twofold. It's an update and an overview on the forthcoming 68th World Health Assembly, which is taking place in Geneva just a couple of weeks away, and also an update on the post-2015 development process, which is really in its final phases in New York, a lot of activity going on around post-2015 and financing for development. So updates on both of those today. So I'll pass straight over to Alena to give you an overview of the World Health Assembly. Alena.
Hi everyone, a very warm welcome from Geneva from me here. I will be starting off giving a brief overview of the official agenda of this year's World Health Assembly, our priorities for the Assembly, and then go into more detail on the relevant agenda items, in particular item 13, which is NCDs, item 14, health throughout the life course, item 17 on health systems, and then item 11 on the WHO reform process, in particular the WHO's framework for engagement with non-state actors, which is currently still under negotiation. And then I'll finish off with a brief overview of WHO side events and our activity at the Assembly. Next slide. So the Assembly will take place from the 18th to the 26th of May at WHO headquarters in Geneva. And the NCD agenda item number 13, will be discussed on Friday and Saturday, the 22nd and the 23rd of May. At least that's how it's indicated in the provisional agenda currently. On this slide, you will also find several links to the provisional agenda, to the preliminary WHA journal, including a daily timetable and an overview of the WHO technical briefs that will be held throughout the week, and then a link to the web page where you can find all of the WHA documents as far as they've been uploaded until now. Next slide. The sort of hot topics at this year's World Health Assembly will certainly be an address held by the German Chancellor Angela Merkel, WHO's response to Ebola, and then of course the framework for engagement with non-state actors, which is still under negotiation, and it's not clear at this point whether we will see it adopted at this year's Assembly. Next slide. Briefly walking you through the week, we'll kick off the Assembly on Monday the 19th with the opening, including an address by Dr. Chen, and then launch straight into communicable diseases, which will carry over into Tuesday the 20th. On the Wednesday of the week, we'll move to the WHO reform and the program budget, and then on Thursday the 22nd, we'll look at health systems, and on Friday, moving over to health throughout the life course and eventually NCDs, which will potentially be carried over into the Saturday as well. And again, at the bottom of this page, a link to the preliminary timetable. Next slide. All right, so looking more specifically at agenda item 13, it breaks down into the outcomes on the ICN2, the Second International Conference on Nutrition, an update on the Commission on Ending Childhood Obesity, follow-up to the UN review and assessment of NCDs, which was held in July 2014. And this document also includes the draft GCM work plan for 2016 and 2017. Other related agenda items are item 11, which is on WHO reform, including the WHO engagement with non-state actors, and then promoting health throughout the life course, including a report on post-2015, and health systems, which is item 17. Next slide. All right. So looking at the NCD Alliance priorities for this year's WHA, the first priority for us really is around the global coordination mechanism for NCD. So the GCM, as we call it in short, has been operating for just a year now. And as we are looking to adopt the work plan for 2016 and 2017 at this year's agenda, it's really a good time to remind member states of their responsibility to engage full and meaningful engagement of all stakeholders. So far, it's been the mechanism has been slow to really engage all stakeholders, and moving forward in the next 2 years, we very much look to member states to ensuring that there will be scope for greater and more meaningful engagement. We are also going to advocate for the passage of WHO's framework for engagement with non-state actors. This has been a very long process, and it's sort of left a lot of processes at WHO in limbo, and so we believe it's important to see the framework passed at this World Health Assembly. In particular, we'll be advocating for the inclusion of NGO secondments in the framework. So far, the WHO has been able to second non-state actors to the organization, and in the draft at the EB in January, we saw a text that did not include secondments from non-state actors anymore. And we understand that this comes very much from a fear around private sector secondments, but we nonetheless insist that the future framework must include NGO secondments, in particular, given WHO's lack of human and financial resources. Our advocacy at this year's World Health Assembly will also, to a large extent, focus on post-2015, really trying to bridge the two processes in New York and Geneva, advocating for an NCD target and an tobacco control target in post-2015, ensuring that these are well on their way for adoption in September, and then specifically looking to promote health and NCDs in the financing for development process. So strong language and strong reference to health and NCDs in the financing for development outcome document, and really emphasizing the importance of healthy domestic, bilateral and multilateral spending on NCDs, and maintaining, if not increasing, the levels of public spending on health in general, also particularly paying attention to tobacco taxation in this context. But this is an area that Priya later on will expand on. Next slide, please. All right, so looking at our first agenda item in more detail, which is the follow-up to the UN review and assessment. And there's a report that you can find online. It's included at the bottom of this slide, providing a summary of the 2014 outcome document, including the national commitments on establishing national targets and plans, and implementing the cost-effective interventions outlined in the Appendix 3 of the Global Action Plan on NCDs. It also looks specifically at the gaps in this document, which is very much around process indicators, and I will come back to this point in just a second. The report also addresses the WHO's role in the follow-up to 2014. This includes a note on the review on the Appendix 3 of the WHO Global Action Plan, and also a registry of commitments from non-state actors that WHO is supposed to develop. It was intended to be, both of these pieces were intended to be developed in 2015, but we now understand that the bulk of this work will most likely only be conducted in 2016 for adoption at the, I believe it's the 70th World Health Assembly in 2017, so a year of delay there. The report also includes a useful timeline of NCD-related activities in 2015 and beyond, as well as in its annex, the GCM Work Plan 2016 and 2017. I will let you look at the work plan in more detail. Very interestingly, it includes 3 new working groups, including one specifically looking at the integration of NCDs into existing programs such as in HIV/AIDS, maternal and child health, and communicable diseases in general. And it also foresees the commissioning of 12 costing studies on NCDs in low and middle income countries, and this will be 2 countries per WHO region. This report also includes more detail on the general meeting of the GCM, which is planned for 2017. Originally, this was planned at highest political level, but because of its proximity to the next review in 2018, it has been proposed that it will be conducted more at a technical level. So no major decisions on NCDs at the WHA this year, and the WHA is merely asked to note the report, including the GCM work plan. Next slide, please. So as promised, a bit more detail on the development of NCD process indicators. So at this year's EB in January, the WHO EMER region put forward a proposal to develop process indicators on the progress achieved on implementing the 2011 political declaration and 2014 outcome document. This proposal was not well received by a lot of member states, and instead the Secretariat was tasked to develop a technical note on, and I quote, how the Director General will report in 2017 to the UN General Assembly on national commitments included in the 2014 outcome document and political declaration, using existing survey tools and taking into consideration existing indicators at global and regional level. And we understand that this technical note is due to be published in the coming week on the WHO website, and it will mostly consist of 10 indicators and several sub-indicators, and will be followed with additional questions in the country capacity survey to report on the indicators. Please note that this technical note will not be submitted to the WHA. The EB did not require this technical note to be submitted via the WHO governing bodies. However, there will be a technical briefing hosted by the WHO Secretariat on the Thursday of the WHO week at lunchtime, and this briefing is entitled Getting to 2018, Preparing for the Third High-Level Meeting on NCDs. And from our perspective, the set of process indicators will be a really important tool to increase accountability and accelerate progress on the commitments from 2011 and 2014 as we move to the next review in 2018. Next slide, please. Also, just very briefly on a side note, an update on the activities of the GCM. The first GCM dialogue was held on the 20th to the 21st of April. Some of you attended this dialogue. It was attended by roughly 180 participants from a diverse audience, including permanent missions, NGOs, and different UN organizations. it was notable that there was a really glaring absence of key development actors, though. So very, very few NGOs working particularly on development, and no bilateral or multilateral development agencies or major donors in the room. So a major shortcoming there, however, good attendance in general. Core themes that were discussed included the investment case for NCDs, so kind of moving away from solely focusing on the burden and the scale of the epidemic to really looking more concretely at building an investment case for NCDs. What is needed? What are we asking for? Also, the integration of NCDs, or how to integrate NCDs into non-NCD and non-health agendas to make NCDs more palatable to other actors, and then specifically looking at financing for NCDs and also civil society strengthening. And I would say that this last point was really one of the most exciting points at the meetings, with presentations from the Danish NCD Alliance, who have been engaging in twinning initiatives with national alliances in East Africa, and really inciting a lot of excitement in the room around what we can do within with the civil society, within NCD civil society. So civil society, NCD alliances in high-income countries supporting NCD alliances in low and middle-income countries, looking at north-south cooperation, but also south-south cooperation. There will be a report that is expected in mid-May, and we are also looking to preparing our own sort of shadow report, looking at a very action-oriented document in terms of how to take the outcomes of this dialogue forward. Next week, the working group on financing will meet on Wednesday and Thursday. The working group also has a new co-chair. Previously, it was Dr. Anders Nordström, who has been called away to the Ebola response, and he's been replaced by Colin McIff, the health attaché of the U.S. mission here in Geneva, who is no stranger to us. He's been very committed in the negotiations on the global entity architecture, and also a supporter of an ambitious GCM. The first day of next week's meeting will be dedicated to a hearing of external stakeholders, and we are aware that the working group has invited presentations from NORAD, the Global Fund, Unit Aid, the World Economic Forum, and the NCD Alliance. So Katie will be presenting to the working group on our behalf next week. If you're interested in learning a bit more about what happened at the first meeting in February, there's a link included on this slide, which you can check out after the webinar. Next slide. So moving back to the official agenda of the World Health Assembly, the ICN2. There's a report online that looks at the outcomes of the ICN2 based on a decision taken at the executive board in January. It looks in particular at how WHO is planning to provide technical assistance, including setting national targets to support the implementation of the commitments in the Rome Declaration. It looks at accountability framework in the follow-up to the ICN2, essentially how the WHO and FAO will report on their on the achievement of the commitments, and then also provides an update on the negotiations ongoing in New York on a draft resolution for the UN General Assembly entitled Improving Nutrition, looking for the UN General to endorse the ICN2 outcome documents, and then also looking at progressing discussions on a decade for action for nutrition. And this decade for action is really to ensure sustained action for nutrition based on a roadmap jointly developed by WHO and FAO, and reporting into the UN General Assembly to really merge the two work streams at WHO and FAO and ensure that there's joint reporting and joint action moving forward. The WHO resolution that it will most likely be adopted. We'll endorse the Rome Declaration and Framework for Action. It calls on member states to implement the Rome Declaration through the Framework for Action, and it's important here to really remind our member state colleagues that the Rome Declaration and Framework for Action is universal. It's for all countries. It affects high-income countries as much as low- and middle-income countries. Finally, it will request the WHO DG to prepare biannual reports to the WHA in collaboration with the FAO Director General. And again, the report can be found at the link on the bottom of the slide. Next slide, please. All right, a very brief update or note on the WHO guidelines on sugar intake. Most of you will be aware that in March, the WHO published an updated global evidence-informed recommendations on the intake of free sugars to reduce the risk of NCDs and adults in children. And these guidelines are very much intended for use by policymakers to implement specific interventions to reduce the sugar intake of populations. It's been a rather controversial subject, and there was also some discussion. I mean, to be expected, there was pushback from the industry, but there was also some remarks from member states at the executive board in January questioning the process to arrive at the guidelines. And luckily, we saw a majority of member states pushing back, though, on these comments, emphasizing that WHO's ability to review evidence and develop guidelines has to be protected. So a very important point. Finally, the World Cancer Research Fund International is planning to publish a policy brief at the WHA entitled Curbing Global Sugar Consumption, Effective Food Policy Actions to Help Promote Healthy Diets and Tackle Obesity. And this will be a really concrete and exciting document providing examples of actions taken in several countries to look at policy actions that, in fact, exist to effectively reduce the availability and affordability of sugar and sugary products and increase the acceptability of alternatives to these products. So a very useful advocacy tool for use with national governments, and we'll keep you updated on the exact launch of that brief. If you're interested in learning more about the guidelines, there's a link included at the bottom of the slide. Next slide. Quick update on the Commission on Ending Childhood Obesity. The report going into the WHO alarms us to the fact that infant, child, and adolescent obesity is expected to increase from 42 million in 2013 to 70 million in 2025 if no action is taken, with the most rapid rise seen in low and middle-income countries. The first draft set of recommendations of the Commission was published in March and is now open for consultations, and the NCD Alliance is in the process of preparing a submission that will be published mid to late May. A series of regional consultations on the draft set are currently planned. The first has been, in fact, held in Manila in March, and we are aware of provisional dates planned for the Pacific Island countries in July, for the Latin American region in the region for the Americas in October, and then the European region end of October in Malta. The meeting will meet for the third time in June this year, and the final report of the Commission is planned for November 2015. It's a very short report, and the WHO is merely asked to note the report. Again, links on more detail at the bottom of the slide. Next slide. Under Promoting Health Throughout the Life course, there is a report on health in post-2015, which provides an update on the process to date and next steps. This report was requested specifically at the WHO Executive Board, as post-2015 had originally not been on the agenda of WHA. The report acknowledges health as a cross-cutting issue and its close links with the other goals in the post-2015 agenda. It addresses specifically the work done on the indicator development, and importantly notes that while we will obviously see some of the targets and indicators from the MDGs be carried forward, it will be important to not lose the valuable work done on NCDs and injuries, universal health coverage, and social determinants of health. So that's a very important point that we should remind member states of. Then rather strangely, it does not mention at all WHO's work as part of the interagency expert group on the SDGs responsible for developing indicators, and it only briefly touches on the financing for development process, not mentioning at all WHO's engagement in this process or the role of financing for development in the greater discussions on means of implementation for post-2015, which is rather concerning. And the WHO is invited to note the report, and there is a link at the bottom of the slide to guide you to the report on post-2015. Next slide. Right, under promoting health throughout the life course, there are two more interesting agenda items, one on women and health, specifically on the anniversary of the Beijing Declaration. At the EB, there was good discussions highlighting the importance of this agenda item, and with several member states highlighting NCDs, in particular, for example, cervical cancer, as a cost-effective intervention that would largely improve women's health. The EB requested the Secretariat in general to make available a longer report, and this report has not been published yet, so I'm afraid I can't give any more concrete details on this item. A rather interesting item for the NCD community is certainly also the Health and Environment Resolution addressing the impact of air pollution. The resolution was originally proposed by the likes of Chile, Colombia, France, Monaco, Norway, Panama, Ukraine, United States, Uruguay, and Zambia, so a broad coalition of countries. And its ambition was to present evidence on air pollution associated with climate change, the links between air pollution and sustainable development, links between air pollution and health impact, including on NCDs and specifically cancer, pulmonary disorders, etc. And then also looking at evidence on the root causes of air pollution. A strong reference to NCDs in the draft as it currently stands. The resolution is still under negotiation led by Norway, and the extent to which the resolution will actually look at the link to climate change as originally intended is unclear, and it's likely to focus more on indoor air pollution rather than outdoor air pollution, so as to not infringe upon sectors outside of health. So these discussions, these negotiations have been going on for quite a while, and it's been a difficult process given that a lot of the themes and the points in the resolution affect sectors outside of health. For a report on this item, there's a link at the bottom of this page. Next slide, please. Right. Under the health systems WHA agenda item, there is a resolution that was approved by the executive board with very broad support, urging member states to increase the availability and accessibility of palliative care medicines and essential medicines for surgery, and it requests the DG to devise measures of access to emergency and essential surgery and anesthesia, and to support member states in improving national legislation to ensure appropriate access to controlled medicines in collaboration with the UNODC and the INCB. And there is a side event also planned on Friday, the 22nd of May, again hosted by several member states to celebrate the adoption of the resolution and to look forward to implementing some of its measures. The resolution text, as was approved by the EB, can be found at the bottom of the page. Next slide. Finally, a very controversial agenda item, WHO reform and the WHO's framework of engagement with non-state actors. The EB decided that they were not ready to adopt the text as went into the EB, and that there were some more points that needed additional fleshing out. The negotiations since the EB have been chaired by Argentina. There was an open-ended intergovernmental meeting held on the 30th of March to the 1st of April, so 3 days. These 3 days were not sufficient to complete a first reading of the text. And since that meeting, informals have been taking place, with informals this week, for example, and then also next week, to finish the first reading of the text. However, it's important to know that the informals have not the same status as the negotiations that happened during the 30th of March to the 1st of April meeting. So the text that will actually go into WJ will be the text as it stood at the end of the meeting that concluded on the 1st of April, so an incomplete text. And it's likely that the WJ will set up a drafting group to finish the text. However, it's still very much to be seen whether consensus can be reached. There's still a lot of issues around the sections on boundaries, conflict of interest, and secondments. As I said earlier, very important from our side is the part on secondments, so ensuring that NGOs can continue to second staff to the WHO. And I've had a lot of questions from people that were interested in sort of an estimate of, can we expect this framework to be in fact adopted? And I'm afraid I cannot answer that question. It's really 50-50 in my opinion. I hear very different opinions from member states. Some are more positive, some are more negative, but there is increasingly a rift, a sort of impatience that can be seen between high-income countries that are very supportive of a more open framework, and then certain low and middle-income countries that wish to see a more restrictive framework. Again, so far there's no document uploaded to the WJ web pages, and I leave you with a link at the bottom of this page to look at the text as it stood coming out of the EB. However, this text has already considerably changed. Next slide. Quick note on another process that is relevant to us in the NCD community, which is the ongoing ongoing process to update the global strategy for women's, children's, and adolescents' health. The first round of consultations were held from February to March via a survey of key priorities, and the NCD Alliance submitted a response to the survey, including a statement on key priorities for the NCD community as it relates to the RMNCH agenda. The first draft updated global strategy will be published most likely on the 5th of May, so next week on Tuesday, and that will be available on the Every Woman, Every Child website. And then launching into a second round of consultation all throughout May and June, where stakeholders are able to provide feedback on the first draft on the global strategy. There will be several WHO side events on the global strategy. The first one organized by the WHO Secretariat on Monday, and that will be at the Delegates Restaurant at the Palais. And then we ourselves are co-hosting a very small closed round table, so it's an invitation-only event together with the PMNCH to engage key stakeholders to discuss NCDs in the updated strategy, and will most likely publish or use the report coming out of this meeting as input into the second round of consultations that will run through May to June. More information on the process to update the global strategy can be found following the link at the bottom of the page. Next slide. All right, quick note on the NCD Alliance activities during the WJ. As we have done traditionally throughout the past years, we'll hold a civil society briefing on the Sunday, so just before the start of the WHA week. This will take place from 4 to 6 at the offices of the Union for International Cancer Control. Invitations have been sent out. If you have not received an invitation and would like to attend, ping us an email. I'll include our email address on a later slide. On Monday, then, our main event entitled From Commitment to Action, Delivering on NCDs and Health in the Post-2015 Era, looking really at the how, so moving away from the what should be included in the post-2015 agenda to how are we actually going to implement an ambitious NCD and health target or health goal in the post-2015 agenda. This event will be taking place at the Intercontinental Hotel, and speakers confirmed for this event, which will be moderated by Richard Horton, our Safari Dr. Ala Olwan, the WHO Emerald Regional Director, Dr. Tim Evans from the World Bank, and Ms. Brenda Killen from the OECD. Further confirmed are the Minister of Health and Civil Society speaker. And then on the Tuesday, the 20th, we'll be co-hosting an event together with Alzheimer's Disease International and the World Heart Federation, looking at an integrated approach for patients achieving the 25 by 25 goal. This event will take place at the Geneva Press Club and is entitled What is Good for the Heart is Good for the Brain. More information on all of our activities can be found at the bottom of this page following the link there. And then, of course, throughout the week we'll be tracking discussions, engaging via social media, in particular Twitter, and seizing the opportunity for direct advocacy with member states. And, of course, we'll keep our network up to date on developments throughout the week via our e-alerts, and you can always reach us throughout the week via email as well. Next slide, please. All right, quick overview of WHO technical briefings, which can all be found in the WHO journal at the bottom of this page. On Monday, there will be a lunchtime briefing on health in post-2015. On Wednesday, specifically looking at WHO's report on climate and health. On Thursday, then, a session on the NCD process indicators, and on Friday, a briefing on cancer prevention and control, which policies and programs have best driven progress. On this slide, I've only included those briefings relevant to NCD, so there are a couple more, and all of these briefings listed here will take place in room 12 in the Palais des Nations. Next slide, please. A snapshot of other entity-related WHO side events. We're starting the week off in the morning with an event organized by the Management Sciences for Health. It's a roundtable on gestational diabetes at lunch, then followed by an event organized by the World Heart Federation titled Marginalized in Their Teens, RHD and Adolescents. Another lunchtime event will be organized by the BRICS countries on nutrition, health, and development, looking specifically on follow-up to the ICN2. And then a couple of member states, including Ecuador and Turkey, are organizing an event on tackling obesity, nutrition, and food security, looking in particular at such interventions as food labeling and financial financial incentives and regulation. On Tuesday, NCD Child is organizing a lunchtime event on NCD's child survival and development for health. In the evening, Brazil, Panama, and the Russian Federation are hosting an event on the Framework Convention for Tobacco Control. Not much detail is known yet on this event, but it very much aims to increase the awareness on the FCTC around ministers of health. In the evening, the International Diabetes Federation is hosting an event on nourishing development, halting the diabetes epidemic through healthy eating. And then finally, on Monday, the 25th, the Union for International Cancer Control is going to look at how to achieve the global target of 80% availability of essential NCD meds and technologies by 2025. And all of these events, many more, can be found on our website, on our very comprehensive calendar of events that includes a much broader set of events. So if you wish to have a good overview of everything that's happening outside the official agenda items at the WHA, go check out our website at the link provided at the bottom of the slide. Next slide, please. All right, so I'm concluding my presentation with a couple of action points for you to walk away with. So definitely reach out to your country delegation ahead of WHA, both to find out what their positions are, what their priorities are, but also to really voice your advocacy messages, and then share any intel on country positions with us. Also, let us know if you're attending the World Health Assembly, and do RSVP for our events on Monday and Tuesday, as well as the civil society briefing on Sunday. If you have not received an invite yet, please email info@ncdalliance.org and we'll send you an invitation. And then I hope that all of this has been useful for you. There will also be an NCD Alliance advocacy briefing that we will shortly publish on our website at the link provided here, with very specific messages expanding on what I already said on this webinar. All right, so that is everything from me, and I'm happy to answer any questions that have come up throughout the presentation.
Thank you very much, Alena, for that really comprehensive presentation on WHA. And just a reminder to everybody that we will be circulating the slides after this call through our e-alert, and they'll also be available on our website as well. So there's a question that's come in, Alena, from Abigail. Will it be possible to follow remotely the proceedings of the World Health Assembly this year? Because obviously that was the case at the Executive Board in January for the first time.
I believe it will be possible. I have to admit I have not looked into this matter more in detail, but we can certainly follow up on that and send out a note to everyone once we send out these slides. But I believe it will be possible, yes.
Great, thank you. And another question. So in the Global Coordination Mechanism work plan for the next couple of years, there is a general meeting scheduled for 2017. What can we expect from the general meeting? Who do we think will be invited, and what the kind of outcomes will be from that?
Right. It's a very good question. So since the Global Coordination Mechanism is a member state-led mechanism, invitations will definitely be issued to governments. Previously, it was intended for this to be really at the highest political level, but member states at the EB requested that the technical or attendance at the technical level or ministerial level would make more sense to ensure good and adequate representation of heads of state and government in 2018 and the next UN-NCD review. We also expect that NGOs and other stakeholders will be invited to the meeting. However, it's really important to reiterate to member states at the WHA that they need to ensure full and meaningful engagement of NGOs in particular at this meeting. At the dialogue on the 20th to the 21st of April was a good sort of experiment to see how well prepared WHO was to in fact engage different actors meaningfully, and they did engage NGOs. However, they had to, in fact, disinvite private sector from the meeting after previously inviting them just a day before the meeting. So need to ensure that these kind of hiccups don't happen in 2017, and then also really ensuring that it's not only the NCD community, but really all relevant actors. So really ensuring the presence of development actors, including international NGOs, but also bilateral agencies, etc., at this meeting.
Great, thank you. We've got another question coming from Deanna at AHA. You touched upon this earlier, Alena, in your presentation around the WHO framework on engagement with non-state actors. And Deanna's question is, what's the likelihood that the NSA policy will be finalised this year? Because obviously we know it's been going on for quite a long time, this process.
Yeah, again, excellent question, and I wish I had an answer for that one. as I said earlier, I hear very, very different things from member states, but very realistically, looking at the fact that they have not, in fact, managed to finalize the text going into WHA. So what we'll see going into WHA will be, in fact, an incomplete text in the sense that it's all there, but it's not all agreed. And it will be a highlighted text with lots of different member state positions that they will then have to sort out throughout the week via a drafting group. And at this point, I find it very, very difficult to estimate or give an estimate of how likely it will be for them to be able to reach consensus. I think there is considerable differences between countries on what level of engagement they wish to see, with some country positions rather extreme on wishing to see a framework that is more restrictive, and then other countries actually now stepping up to say, no, we're not going to agree a framework unless it's actually allowing for more opening. So very, very difficult question, but a really good one. I'm sorry, I cannot give a better answer.
So it could go either way, really. And then just one final question from me before we move over to Priya on post-2015. Obviously, as you said right at the beginning, this year at WHA, there's no kind of major decisions on NCDs, and obviously NCDs are also being discussed right at the end of the week, unlike previous years where it's hit a lot earlier in the week. Should we as the NCD community be worried by that? Is it an issue that the NCDs won't, be kind of central stage during WHA this year?
I don't think we have to be worried about that. I think it's sort of a natural outcome of political processes. Not every issue can be front and center every year. NCDs have enjoyed a very sort of were discussed early on in the week in previous years. And given that there's no major decisions up this year, it's sort of a natural development that it will be discussed a bit later during the week. However, I think looking at the calendar of events, looking at the different side events organized by member states or different side events organized by NGOs, I believe there is a lot of focus on NCDs, and by no means should we worry. It's definitely important for us as NCD advocates to set up meetings, meet ministers of health, meet delegations, and follow up on what they're doing, what is happening concretely at the national level. So I think it'll be an excellent opportunity to really, catch up with our key contacts on what's happening on the ground. But I don't think we should necessarily be worried by this at all.
Great, thanks. And one final question, Alena, quickly. Another question came through from Abigail. Which country will be leading the drafting group for the non-state actors policy?
Right. So the negotiation process currently is led by Argentina. I'm not sure whether they will then also be appointed to lead the drafting group. Usually drafting groups are led by two member states, so one from a high-income country and one from a low-income country, so most likely there will definitely be an additional member state leading the drafting group. So it could be Argentina and another country, or it could be two different countries. But I would assume that they will want to continue with Argentina and then add another member state to that.
Great. Thank you, Alena. And just a reminder to everybody that we've now got web pages on our website dedicated to the World Health Assembly with all of the information that Alena has provided, including the calendar of side events and links to all of the official papers on the WHO website as well. So after this call, have a look at the website. Okay, let's now go over to New York to Priya to hear about what's been going on the post-2015 development process. Priya.
Thanks very much, Katie. As you said, there is quite a lot of activity here in New York around the post-2015 agenda and the financing for development processes. So I will be giving everyone a quick update on the post-2015 intergovernmentals that are going on, the preparations for the Third International Conference on Financing for Development, FFD, and the processes moving towards the September summit, and then finally some advocacy points that we would like you all to take. Next slide, please. So how we get to the post-2015 agenda. There are the intergovernmental negotiations, 8 sessions that began in January and will go through July. So thus far, there's been 4 of those sessions. The remaining 4 will cover the follow-up and review, followed by 3 sessions devoted to the negotiations on the outcome document. There'll be 4 sections of the agenda: the declaration, the goals and targets, also known as the SDGs, which will be the main component of the agenda, then the means of implementation and global partnership, and finally the follow-up and review. Next slide. So this is just a visual timeline of these negotiations. We're about halfway through. The next session will be coming up in May, and I'll be speaking a little bit about the March and April sessions that were held and talking about what we expect for May too. Next slide. So the March session on post-2015 was held from the 23rd to 27th here in New York. The session covered the SDGs and their respective targets, and member states expressed their views on how the proposed SDGs from the Open Working Group document should be incorporated into the agenda. They also discussed proposed technical revisions to 19 targets. That was a document issued by the co-facilitators of the process, and then also provisional global indicators, which were presented by the UN Statistical Commission. So there was consensus, more or less, that the SDGs and their targets should be the basis of the post-2015 agenda and should be incorporated without any amendments into the agenda. And this consulted in this consensus resulted in many member states being kind of wary of the proposed target revisions presented by the co-facilitators, as some member states felt that discussing these revisions might open the door for renegotiation of the goals and targets. So that is something to be a little wary of from some of the member states. And finally, the UN Statistical Commission, UNSC, presented their provisional global indicator framework to give member states an indication of how indicators for the SDGs might look, and member states in return offered guidance on how they viewed the process moving forward, and there was a discussion of the indicators and how that came about. Next slide. So from the March session, there are more or less 2 main viewpoints on the process, 2 main trains of thought, and these are illustrated here. The G77 is referring to all developing country blocks, so that would be G77 in China, small island developing states, African group, Arab states, etc., whereas the EU is referring to more of the developed states, so EU, US, Canada, Australia, etc. So countries spoke as blocks first and then aligned their national views with the blocks, as they're doing for all intergovernmental sessions. So things that we saw from these were that the G77 are calling for the entire Open Working Group document to be included in the final agenda. This includes the chapeau, the SDGs, and their related targets, and finally the reservations that member states expressed at the end of the Open Working Group. On the other hand, the EU and the developed states are calling for only the SDGs and targets to be included in the agenda, not calling for the chapeau or the reservations. Some EU members and developed countries stating that they don't want to ask their heads of states to sign on to reservations made by other member states. So that's what kind of came out of the March session on the SDGs. In terms of the proposed revisions to 19 targets that the co-facilitators presented, G77 and developing countries overwhelmingly rejected these revisions. Again, they felt that this would potentially open up all goals and targets to renegotiation, disrupting the political balance that was achieved from the Open Working Group. So they're overwhelmingly rejecting that. The EU and developed countries, on the other hand, welcomed the exercise as a necessary technical one, stating that some changes were necessary to make certain targets achievable in the time set for them. All countries agreed that they needed more time to consider, and so we will see these proposed revisions coming up again in the May session, and I'll speak to that in a little bit. And finally, the proposed provisional global indicators that were presented by the UNSC. The UNSC proposed document that had 2 indicators per target. The G77 stated that they would like at least 1 indicator per target with political oversight, so meaning the post-2015 track and its member states would have oversight of development of these targets, whereas the EU really called for a limited number of indicators and that this should be developed through a separate technical process led by the UN StatCom, or UNSC. Next slide, please. In terms of NCD-related targets, two were brought up for potential revisions, that being 3.6, which covers global deaths and injuries from road traffic accidents, and the proposed revision is to change the date from 2020 to 2030, which is a technical revision that technical experts say would make this target achievable. As it currently stands, many experts are saying that it will not be possible to have the number of global deaths and injuries by 2020, but by 2030 it is indeed possible. And the other proposed revision is to 3.B, which would involve the deletion of the word essential before medicines, as there is no consensus around what constitutes an essential medicine. So the co-facilitators are issuing new proposals about these revisions for the targets, which will be discussed in May. They will also issue proposals for any X values currently stated in the targets so that the target moving forward will be a little bit more specific. Next slide, please. So a little bit more about the indicators. It's one of the hot topics for this entire process. So the proposed indicators for target 3.4, which is the NCD target, there are two of them: the probability of dying of CVD, cancer, diabetes, or chronic respiratory disease, and then current tobacco use. So it's important to note that the initial list put out by the UNSC is very preliminary, and it was done at the request of member states so that they might have some indication of how this indicator process will look moving forward. So the UNSC is calling for a limited number of global indicators, and it will be led by the Interagency Expert Group on SDGs, which is similar to the group that was set up to develop the indicators for the MDGs. It will be made up of 27 members from within the UNSC, so these are country-level experts. It's a highly technical process and will be ongoing through March 2016, but the IAEG SDG will first meet June 1st and 2nd, and they will provide an update to the intergovernmental process also on what these indicators might look like moving forward. By July 2015, we expect criteria for the global indicators to be released, and this process will keep going until March 2016 when the UNSC meets again, and they meet annually, and March 2016 is when these global indicators should be presented and endorsed. During the May session, the upcoming May session, member states are to decide who will take political oversight of the process and also agree that language in the post-2015 agenda, the declaration aspect, should be set that recognizes the ongoing work to develop indicators in lieu of presenting a complete indicator framework as that work is ongoing. Next slide. So the post-2015 agenda, as we know it, does not include how the implementation of the agenda will be financed. So during one of the sessions, a speaker said that, post-2015 will require scaling up from billions in development financing to trillions. So that brings us to the financing for development process. Next slide. So the third International Conference on Financing for Development will be held in Addis Ababa in Ethiopia from the 13th to 16th July and will result in a negotiated outcome document on FFD. The initial preparatory process involved 3 negotiating sessions, but after this most recent April session, the co-facilitators and member states both realized that much more time was needed in order to reach any sort of consensus. So additional sessions have been scheduled from May 11th through 15th, the 26th to 29th, and then a final provisional week of negotiations should they be needed from the 1st through 5th of June. And the final session will be held from June 15th to 19th, and the co-facilitators have been quite adamant that come June 19th, they will leave with an outcome document to take to Addis and agree on. So prior to the May 11th session, the co-facilitators will release a revised zero draft of the outcome document, which will be based on the comments during the April drafting session, also the joint session with the post-2015 track, and on written input submitted by member states and other stakeholders. Next slide. from this April session on FSD, a number of key challenges and questions arose, mainly revolving around how the FSD and post-2015 processes should be interlinked, to what extent are they interlinked, what the monitoring and review of the processes should be, whether there should be one process or two processes. So let me go into a little bit more detail about that. Member states, I will go into more detail on the next slide visually too, but just to do a little overview, member states expect that FSD will cover the means of implementation for the post-2015 agenda, but one of the key questions that arose was, will FSD be the only basis for MOI for the agenda, or will additional MOI be required outside of FSD? And then also, because these two processes are so interlinked, will there be only one review mechanism for them, or should they have two separate due to their different mandates? So the next steps in this is that the revised, as I said, the revised draft outcome document will be released early May prior to the 11th session, and a compilation text of all views expressed during the April drafting session and of the comments submitted will be also released. So that we expect that will not be the basis of negotiation, so that will be the draft outcome document. Next slide. So some of the priorities for us as NCD Alliance and as health advocates for FFD, really strengthening the financing for health references, calling for sustained improved spending at all levels, health system strengthening, etc., really calling for stronger NCD language, better language on continuum of care and TRIPS. Also, we're calling for a standalone paragraph under the domestic resources section on tobacco taxation and strengthening the reference to FCTC, illicit taxation, and whatnot. So these are some of the priorities that we're really asking everyone to push within their own country level and advocacy messages. Next slide. Moving on to this most recent post-2015 session, it was a joint session with post-2015 and FSD, so all four co-facilitators were present during the entire week. The session covered the means of implementation and global partnership. So a lot of discussion around this was what belongs to post-2015 and what belongs to FSD. So financing, but also where does means of implementation lie, to what extent, which track is going to cover technology, trade, capacity building, etc. Also, again, the role of FSD within post-2015. Is FSD the main pillar of means of implementation for the agenda, or as some member states see it, is it only part of the MOI, and should there be other external MOI outside of FSD? A big topic of discussion was the global partnership. What exactly is this new global partnership? And there were some member states who were defining this global partnership as the big global partnership of all countries to implement the agenda versus smaller global partnerships between multilaterals, bilats, and whatnot to implement the agenda. Also, the role of the private sector and civil society was discussed, and a lot of member states recognized the need to involve all stakeholders in order to fully implement the agenda. Then finally, again, how to integrate FFD outcomes into the post-2015 agenda. Is it, again, the entire all FFD outcomes into post-2015 or just some of those outcomes? Again, many member states brought up the fact that FFD and post-2015 have different mandates, and moving forward that we need to respect those mandates. Next slide. So as we saw before, again, there are two main points of view, again, developing and developed countries, more or less. So under the relationship of post-2015 and FSD, G77 and developing countries really advocating that these processes are separate yet complementary, and that post-2015 should really address any aspects that FSD did not address within FSD's mandate. So they're calling for separate MOI outside of what FSD addresses. Whereas EU and developed countries are saying that the ADIS outcome will be the pillar of MOI and should be included in the post-2015 as such. So they're calling for no additional MOI outside of ADIS. Moving on to the global partnership, G77 is saying that, it's a strengthened global partnership as such that we already have, and calling for a balanced role of the private sector and how they are involved. The EU is saying that this global partnership, in order to implement the agenda, will involve smaller multi-sectoral partnerships, also saying that we should involve all relevant stakeholders. Moving on to monitoring and accountability, G77 and developing countries are saying that, again, because these processes have two separate mandates, there should be separate monitoring and accountability mechanisms that are linked to provide coherence between the two processes, but then also that they are very separate. The EU, on the other hand, are saying that a single monitoring, accountability, follow-up, and review process is called for since the two processes are so interlinked, and that we can still respect the mandates by having one follow-up process. So this follow-up and review is something that will actually be discussed in the May session. Next slide. So this May session will be held from 18th to the 22nd, which is conveniently during the World Health Assembly. So there's a lot going on in May. Member states will present continued views on follow-up and review, including the monitoring and accountability mechanisms, which they began to present during the joint post-2015 and FFD session in April. And again, some are calling for one mechanism to aid coherence and others for two, citing the different mandates of the processes. In addition to that, the UNSC will provide an update on the global indicator process and also provide criteria for the indicators, and we expect they will give a little bit more clarity on the IAEG SDG. Finally, the co-facilitators did say that they expect there might be one more joint session with all four co-facilitators present to provide further clarity on the intersection of post-2015 and financing for development. In terms of advocacy, we will continue to engage with member states to retain the strong health focus in the agenda, especially including NCD's target and the MOI targets, and then continuing to coordinate with other stakeholders for the process. Next slide. So as many of you know, we launched our new advocacy toolkit. It's now available in English, Spanish, and French and you can download it through the link at the bottom of the page. So we really encourage everyone to use this in your advocacy messages as we continue to move forward through the process. Next slide. And so finally, what we can do moving forward, I really continue to track the processes. It's very quickly moving. There's a lot going on, and so please reach out to us with any questions you might have, as there's a lot going on with the two interrelated processes. We're calling for the May CSO hearings, which will be on the 26th and 27th here in New York. All CSOs can register, and the link is there on the slide with more information on how to do so. And again, calling for everyone to use the post-2015 toolkit and resources to aid in their advocacy. And please, let us know what you are doing so we can help support and coordinate. And happy to answer any questions, as I know that it's quite a complicated process.
Thank you very much, Priya, for that really comprehensive presentation. So a few questions have come in. We've got one from Lois. A little bit confused about member state claims that there's no definition of essential medicines, and this is obviously regarding the changes in the targets being proposed in post-2015. Obviously, as WHO has a clear process for identifying and recommending them, which is the WHO model list of essential medicines. Have you got any more intelligence, Priya, around where that's coming from and why?
Hi, Katie, this is Aria. I'm actually going to jump in and take this one. And Lois, thanks. That's a really good question. And the short answer is that the use of essential here is not with reference to the definition of essential by WHO standards, but actually backs right into the question of how we use essential with regard to TRIPS flexibilities and intellectual property when it comes to access to medicine. So if the intention was for the financing for development outcome to speak directly to the means of implementation targets, you'll recall that one of the MOI targets is around access to medicines and the use of TRIPS flexibilities to improve access to medicines and vaccines. Now, due to some, I think maybe perhaps misunderstanding or political intention, Target 3B on TRIPS flexibilities includes the word essential. But if you read the actual Doha Declaration and the public health clause in the Doha Declaration, it does not use essential. So there's a bit of a disconnect between the way the Doha Declaration is worded and the way the means of implementation target is worded. So then translate that into the financing for development outcome, which calls for increased resources around financing for development, and as well as the target 3B is currently written. There's sort of this issue on, well, if TRIPS in Doha doesn't reference essential, how can we have a target and an FFD outcome that includes essential meds? So it's really more of a disconnect on TRIPS and language there rather than, WHO or WTA not having a definition for essential. So I hope this answers the question, and we can, of course, talk more about this offline if you wish, because it's quite complicated.
Great. Thanks, Ariella. A question coming from Lena around post-2015. Is it fair to say that the G77 and the EU positions are opposite on many issues? How will this further impact the negotiations as we go through these last few months of the process?
Thanks for that. Yes, it is fair to say that they are quite opposite in views. But, it is important to note that we are discussing an ambitious agenda, one that is calling for all countries developed countries in particular, to maintain their ODA commitments, whereas they're calling for all countries to take responsibility and action and increase domestic resource mobilization. So developing countries are really worried that if they lose ODA commitments from the developed countries, that they will stop having that influx of resources, which many of them still depend on. And I think moving forward, it's a matter of finding that balance in between responsibility from developing countries to move forward with the agenda and implementation of the agenda, and making sure that developed countries commit and actually deliver on their ODA commitments. So I hope that helps a little bit, but we do expect that things will, as political negotiations go, kind of iron themselves out, hopefully.
Thanks, Priya. We've got a question from Anne. So obviously, based on your presentation, Priya, there's lots of different moving parts within this process still, both in terms of the indicators, both in terms of FFD, how everything comes together. So Anne's question is, what's the NCD Alliance's position in terms of will there be a document for decision in September at the UN General Assembly summit on this issue?
Thank you for that. Yes, there definitely will be a document for decision in September. It just is remaining to be seen to what extent indicators will be included, to what extent FFD will be included in that outcome document. But the document will be there, the agenda will be there for heads of state to sign in September.
Excellent, thanks. I've got a question of my own. So obviously you were talking a lot about the indicator process, which is very technical, as you noted. And I just wonder, how important are the indicators in the grand scheme of things, based upon the Millennium Development Goal experience, based upon other ways of monitoring other health issues? How much attention should we be paying to the indicators for the post-2015 agenda?
Thanks, Katie. So the indicators are quite important. The UNSC Statistical Commission did cite the experience from the MDGs, stating, that we had a limited number of goals, targets, and indicators, and now for the SDGs we have many, many more than the MDGs. So, which is really why they're calling for a limited number of global indicators to kind of aid in the achievement of those indicators and targets. We expect that these global indicators will be supported by a much more robust national, regional, subnational, sub-regional indicator framework, which will really be set forth by the relevant country-level statistical institutions. So for now, we're talking global indicators, which will just be really the top-level indicator process. What we saw, the original provisional indicator framework, so what we expect to see now in May, it's going to have greatly evolved. So one we see in May not have those same 2 indicators per target. It may be a little bit different from that. So we're really waiting to see what happens in May to see how to move forward.
Great, thanks. So So we're talking global indicators now, but then further down the road, perhaps after March 2016, the real focus will be on country-level indicators, where obviously a lot of our country-level advocates can play an important role in influencing them as well. We have another question from Abigail. The question is, I do not understand the distinction between one global partnership and multiple partnerships. Can you please clarify, Priya or Ariella?
Thanks, Katie, and thanks, Abigail. I will go ahead and take this one. Nobody really understands the distinction, to be quite honest. It's a pretty difficult discussion to follow. The best that we have sort of been able to discern is that, global partnership, no S, is one large mechanism whereby all member states and all actors are a part of this single mechanism for accountability, whereas a global partnerships with an S, or a set of global partnerships with an S, would be smaller, more nimble, agile, perhaps thematically oriented, multi-sectoral, or multi-stakeholder partnerships. So think in terms of like the Global Fund or Gavi, for example. Those were often brought up as two really good examples of thematic specific, so in this case, health, nimble, smaller, multi-sectoral partnerships that are able to move the certain parts of the agenda forward without becoming these sort of all-encompassing, perhaps too large to manage partnerships. So I think that's the best way of describing the difference between global partnership, no S, and global partnerships with an S.
Great, thanks, Ariella. It's interesting that there's so much focus on means of implementation and partnerships particularly. I guess it's partly because MDG 8 was obviously on partnerships, and many people have said that that's one of the areas that saw least progress. So hence why there's much more focus on means of implementation this time around, and partnerships being one of the mechanisms that's the focus there. Let's go on to a question from Lena. Are you aware of any relevant side events at the Financing for Development conference in Ethiopia? Ariella or Priya?
Thanks, Katie. Not at this moment. The modalities actually for participation at the FFD conference are still being decided and negotiated, so we don't have any information yet on how civil society and other stakeholders will be involved at the conference. We expect it to be released soon, but we do know that the NCD Alliance is planning an event with Denmark at Addis, and so we know that will be there. We're just waiting on modalities for the conference to be released.
Excellent, thanks. And you also mentioned, Priya, in your presentation around kind of monitoring and accountability of post-2015. Obviously, lots of different ideas around that, and whether there'll be different mechanisms for monitoring the post-2015 targets and indicators and monitoring of means of implementation. Has there been much discussion around the kind of idea of independent accountability? Obviously, within that, you'd assume that civil society would be involved, ensuring that governments are kind of keeping to their commitments.
Katie, I'll jump on that one. So the session in May is actually going to unpack the question of accountability a bit further. For right now, we've just seen it sort of notionally touched upon in passing by member state statements. Independent accountability hasn't been talked about so much as of yet, but the idea of mutual accountability has, whereby member states, some are thinking that they want to all jointly hold each other accountable or be accountable to the UN system, whereas other member states don't want to be held accountable and would prefer that they do their own sort of monitoring and rather review and report back in a more informal basis. So that's really the focus of May, though, is to further unpack the question of accountability and review and how exactly everybody reports their own progress and who has oversight and the role of civil society as we look at the implementation of the post-2015 agenda.
Great. Thank you, Ariella. And one of the questions is from me. So, Priya, you mentioned on the 26th and 27th of May in New York is the UN Civil Society hearing for post-2015, and the link to register is now up. How much do you think the NCD community should be focusing on that civil society hearing and making the trip to New York to be there?
Thanks, Katie. I think so. The civil society hearings are supposed to be input onto the September summit, but we expect it'll really be input into the agenda in general. So I think it would be important to have a strong NCD health-related focus at the hearings. So if people are able to make the trip, we would definitely welcome it. We here in New York, Ariella and I will be at those hearings, and definitely welcome any other supporters that can make the trip.
Great, thanks, Priya. I think those are the last questions that we've received. So I think we'll close the webinar. Thank you very much, everybody, for joining today. Just as a reminder, again, we'll be circulating the slides via both our website and also on our e-alert that will be going out this evening. Also, we'll be holding our next webinar early June, and the focus of that one will obviously be updating you on what happened at the World Health Assembly, what are the main outcomes for the NCD community, and then also obviously updating on post-2015, because we'll be coming into the real crunch time of the whole process by then, if we're not there already. Thanks everyone for joining, and look forward to speaking soon. Thank you, goodbye.